Good evening, everybody. I'm Sayukta, your host for today's live from All About Skin Wellbeing team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would have encountered at some point of time in our lives. Urticaria is characterized by a round rash on the skin that itch intensely. It may be due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venereology and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidences are higher in older age groups. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can actually worsen the symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's always a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, and right treatment and management approach for an early relief. So today we have with us renowned dermatologist Dr. Hardik Pitroda, who is a young and dynamic cosmetic dermatologist practicing in Memnagar, Ahmedabad, and has an experience of 6+ years in the field of dermatology and cosmetology. Dr. Hardik believes in catering precise and rightful treatment to all his patients. His key expertise is in treating acne, pigmentation, and hair loss. He has wide experience in cosmetic treatments like chemical peeling, derma roller, platelet-rich plasma therapy, that is PRP, etc. He's also a member of International Society of Dermatology, ISD, Indian Association of Dermatologists, Venereologists, and Leprologists, that is AIADVL, and Cosmetic Dermatology Society of India, CDSI. A very warm welcome to you, Dr. Hardik. It's a pleasure to have you with us today.
Thank you so much, likewise, for your warm introduction and kind words. So I'll be really happy to guide all the viewers and listeners to basics of urticaria, which is a very common problem these days, and it's
Right.
high time that people should be made aware about its condition.
Yes, you have very rightly said it. It's the high time we should aware people about urticaria and its management. So to start with, doctor, we would first like to understand what is urticaria.
Yeah, so if we would like to put it in a simple language, urticaria is a type of a skin rash which leads to itchy red skin lesions, and it can occur very suddenly or it can develop slowly, and it is a type of allergic reaction in the skin.
Okay, doctor. And doctor, what causes urticaria?
Yeah, so say urticaria is like it's an allergic reaction. So we have to look around us everywhere. There could be a trigger in each of the everything that we are looking at. Sometimes even the triggers are inside the body as well. So generally, the most common allergens that we face in our day-to-day practice is the food, infections, sometimes drugs, and sometimes people are having some internal conditions like thyroid, diabetes, which is very common these days.
Right.
So a list of reasons for the urticaria, but these are the common which we look in our practice.
Right. So n number of factors could be responsible for urticaria. Now, doctor, the thing is that, normally when we get any kind of allergy or skin, reaction, we do get rashes, they do itch a lot. But then we would like you to shed some more light on how does it look like so that we as laymen can understand that, okay, this is urticaria and we need to go and consult the dermat.
Exactly. So yeah, there are some key points which helps us in differentiating from the other conditions. So
Hmm.
the classical thing about the urticaria is that the lesions are bit swollen and they're red in color, and they are generally fleeting or they are evanescent. They don't stay for long time. After a few hours, they generally subside on its own, and they can be in a small group or they can be generalized all over the body. And sometimes urticaria can be associated with swelling of soft tissues like lips or around the eyes, which is called angioedema. So yeah, it can be sometimes just the skin lesions, or sometimes it can be just swelling on the lips and eyes. So we have to be careful while examining the patient.
Right. As you said that we need to be careful, doctor. We need to find out, or we need to understand from you that how severe it could be.
Exactly. Yeah. So sometimes, we look at it as a very trivial allergy, but sometimes in the matter of few minutes, that swelling can sometimes in fact involve your windpipe or vocal cords, and sometimes even the intestines and esophagus. So it causes a kind of an acute emergency situation. So if you are aware about the simple things, then you can prevent the complication at the earliest.
Right. That's why it's very important to be aware of what it is and how complicated it could be. So it's important to go to the right person, which is a qualified dermatologist, in case you see urticaria or the signs that just have been explained by the doctor. Doctor, but the thing is that when we get any kind of skin allergy, the first thing that we do is to try some home remedies, some quick fixes, or go to a pharmaceutical, shop, get any over the counter anti-allergen, and because it do give us some relief, so we think that this is it, and we never go to a doctor until and unless the case or the thing become out of control. So what's advice like to give to those who specifically go for over the counter medication?
Yes, exactly. So, especially in today's era where medicines are so easily available and a lot of information is also available on the internet, but still, I would insist that avoid over-the-counter drugs without any advice from a doctor, because you might think that this is something particular condition and it could be something else. And as I told earlier, if it is an impending angioedema which can cause swelling in your windpipe, then your breathing becomes very difficult, and that creates an acute emergency condition. So if you are overlooking the simple thing, and that could be something, a big thing is waiting to happen. So I generally recommend that you should consult a dermatologist as soon as possible. In worst case scenario, yes, definitely you can take some over-the-counter antihistamines, but try to contact doctor as soon as possible.
Right. So what may be looking to you as just a rash, which is itching a lot, may actually can go really serious and severe. So please don't self-medicate. Go to a doctor as soon as possible. See the right person, which is a qualified dermatologist. That is really important. Now the thing is, doctor, again, apart from your over-the-counter medication or getting any anti-allergen, we also try to do something at home. What we call home remedies. We really love doing some home remedies, and we feel that we can actually treat it in a natural way. Now we'll keep on putting something, applying something. I'm sure you also get patients who come with you, with they have already experimented a lot over their skin in terms of home remedy. So what's your advice on that?
Yeah, exactly. So there is a very common tendency to opt for some simple treatment like home remedy when you get this kind of rashes. Yes, it may work in sometimes also. Maybe two or three cases out of 10 might work with simple home based something. But again, we have to understand it may be urticaria, or it could be a simple insect bite or ant bite, which we are thinking is an urticaria. So it can sometimes work, but it does not mean that everything home remedy will work. And generally, as per the urticaria, topical or applying anything on the skin is generally not going to benefit a lot. Even medicated solutions, we generally don't recommend applying because they generally do not work. The most important thing is to give the right medicine at the right time. That is the
Right,
best
and
thing.
it's equally important to get it diagnosed to find out that what is the triggering factor. And for again, that you need to go and consult a doctor. Your home remedy, your ingredients won't work for that, and neither your chemist is going to tell you that what's causing this, right? So for that, you definitely need to go to a dermat. Now, the doctor, the thing is that we can classify urticaria in acute and chronic. We would like you to shed some more light over these classifications. What is acute, when it becomes chronic?
Exactly. Yeah. So this is a very basic classification for urticaria. So when the urticaria lesions are for short time, less than 6 weeks, then it is considered as acute urticaria. And when a person tends to get repeated reactions or flare-ups for a span lasting more than 6 weeks, it is termed as chronic urticaria. This is the basic difference. And another thing is the acute urticaria is generally self-limiting. So generally, we also just take it as a very initial episode. We do not go into the depth and try to investigate a lot. But yes, when a patient is having a chronic urticaria lasting more than 6 weeks, we definitely look deeper, try to find out the reasons, and we even investigate the patient. So this is how the basic classification is.
Right. In chronic cases, many a times patient will say that, they are fed up with the medication and they want to know that will it, ever get cured, or will I get a permanent solution or relief from it? What's your answer to that?
Yes, this is a very common and very good question because this is what people really want to know, when this will be solved actually. Yeah, the thing is that you have to understand the overall what is this condition and why it is happening, what is the pathophysiology. So in most of the cases, we try to find the reason, but sometimes we are still not able to find the reasons why the urticaria keeps on happening. So in that scenario, it is always best to continue the medicine for a longer period of time till the dermatologist feels is right, and then slowly the dermatologist will try to taper it off. But don't try to stop or start treatment by on yourself or something. And generally, sometimes with doing the treatment in right way for certain months, the urticaria can sometimes subside on its own. So yeah, that is the most important. So I think the key thing here is to educate the patient why this condition is so unique and why it is so different. Sometimes a friend of the patient might be taking some simple tablet and he's getting the cure. And in your case, the
Mm.
condition is not improving. It's very possible. It's very subjective. So we educate each and every patient in depth, and then we start the treatment.
Right, doctor. And doctor, what are the potential complications of urticaria if left untreated?
Beyond the simple things like itching or burning sensation which it causes, but when this kind of condition keeps on happening on daily basis, it starts affecting your mind, and that leads to anxiety, stress. Even you start losing interest in the common thing. It's difficult to work. Even your personal and family life starts getting hampered. So these are the grave implications of urticaria, which are generally overlooked in day-to-day basis.
Right.
So this is what we generally say. And as I said, the severe complication of urticaria can be angioedema or anaphylaxis. So it is like an emergency situation where you are not able to breathe, and it creates a very difficult situation. So these are the two things which I would like to share.
Right. So, if we keep it untreated, then definitely there are chances that it can go to that severe level where we can get, anaphylactic shock or angioedema, angioedema. And without that, also because it's definitely hampering our life, the quality of life, and we can get relief from the itching, etc. And live a normal life just by the help of a doctor. So just we need to go and visit a doctor as soon as we see the signs and symptoms. Now, doctor, as you said, because we can very well imagine what kind of life the patient goes through. Um, he or she is, all the time itching, and a lot of irritation is involved. It's very annoying, embarrassing at the same time. So definitely the patient is under stress. Now, is this stress going to aggravate the urticarial rashes or the condition?
Yes, definitely. So the recent research has established that when you are under a lot of stress or you are very anxious, it releases certain kind of mediators in your blood, and that mediators can also lead to urticaria. It becomes like a vicious cycle. So urticaria causes stress, and then stress again aggravates urticaria. So yeah, these days we are counseling our patients to indulge into some kind of positive things like exercise or meditation, which helps in controlling the stress levels. So yeah, that is the most important thing in today's era, controlling the stress.
Right. And to break that vicious circle, again, we need to go and consult the right person, the right skin expert, because there are so many quacks. The quackery is, increasing at a rapid phase, and Plus, there are others who claim that they can actually be of some help. There are influencers online. So I'm
Mhm.
sure you also get patients who say that, see, I have gone through what the influencer has told me to, or I've been to various places, but now because I'm not getting benefited, now I have come to you. So we will end up wasting a lot of time and all this by the time we reach a doctor, right, doctor?
Yes, exactly. That is very common problem these days. And yeah, it becomes really challenging when when you see that kind of patient who you feel like is like half-hearted, who is not very sure whether he or she will take your treatment. But we try our best to educate them and counsel them that yes, it is possible that you might have not have got results previously, but we are trying. And if the treatment is done in the right way for right duration, definitely we are able to achieve very good results.
Right. And many times patients with urticarial rashes do complain that their hives or urticaria get worse during night. Is there a
Exactly.
correlation, doctor?
Yes, not very much proven, but yeah, this some studies have established that chronic urticaria aggravates in evening or late in the night, and the possible reason could be that when you are about to sleep, your mind is really relaxed. Then you are able to focus on a minor itching or discomfort that you're facing in the skin or body, which in the daytime you might ignore. So that could be a common reason why you feel that itching is more prominent at night.
Right. We have Purvi Mehra with us. Purvi is a viewer, and her question is, will my urticaria go away on its own?
Yeah, so yes, Purvi, so that is the main question that we are targeting today. Yes, so that's what I told the acute urticaria, which is like lasting less than 6 weeks. In that kind of scenario, we generally don't really advise lot of treatment. We just ask them to control whatever itching you are having and wait for some time. If your symptoms are lasting more than 6 weeks, then definitely I think you need a treatment in a proper way where we will try to investigate your blood and urine and try to find out the triggers for your urticaria. And in that scenario, we generally recommend a course of 3 to even 4 months. So yeah, when the situation is like that, you should not ignore it.
Right. We have Tina Bhargav with us. She is 19 years old, and her question is, what treatment options are available?
Okay, so yeah, since you are 19 years, so all the treatment that is applicable to adults is possible in your case. So generally, the first line of treatment in urticaria, as I told you, is patient education, and we have to start observing ourselves. Start maintaining a diary, like observe for all the possible triggers, maybe food or seasonal change or any medicine if you are taking and it is triggering your urticaria. Apart from this general measures, as a proper treatment, we recommend a class of drugs which are called antihistamines. So antihistamines are made like that once they are which is in your body, it controls the symptoms of urticaria, that is the itching and the lesions. So we always start with antihistamines first, and if you are not able to control with a particular dose, we generally tend to increase the dose up to 4 times. That is the general guidelines. And if antihistamines don't work, then we look for some other molecules. But rarely in clinical practice, we tend to use other drugs. But these are the common medications, antihistamines.
Okay. And doctor, do kids also get urticaria?
Yes, absolutely. There is nothing like any particular age group. Even
Mhm.
kids as young as like infants are getting urticaria. But again, in kids, what we have observed from our experiences, the urticaria generally is very self-limiting, does not last beyond few weeks or months, and generally they are not that bothersome. Then
Mhm.
what we see in adults, like that.
Right. And many a times, after recovering from a fever or infection, especially in kids, we have seen urticarial, lesions or rashes. So, what's your advice?
Yeah, so as I told you that infections is a very common cause of urticaria. So post-viral infection, getting urticarial rash is very common. So no need to get freaked out or afraid about it. Once your viral infection subsides, our body automatically starts filtering all the germs from the body, and your urticaria also subsides. So when you get urticaria after viral infection, generally it is very short lasting, and it gets solved easily.
Right. I think due to the very same reason, we saw a lot of cases of urticaria or hives during COVID era. You know, people who were COVID positive were also complaining about hives.
Exactly. Yeah. Even a lot of viral infection itself produces rashes on the body. So
Hmm.
sometimes people tend to get confused between the rash of virus as well as urticaria. So both of the situation is possible. That is why I told that diagnosis is very key in this case. Sometimes people feel it is urticaria, but from that only we can suspect that it is a viral infection. So
Right.
this is the
And that's why we are repeating again and again that you need to go and meet or take advice from a qualified dermatologist or go and see a doctor. Don't take it lightly or don't just suffer in silence. Many a time there are people who will keep on itching, who will stop socializing, stop going out in public because they are having this itch related issue, but they'll never go in front of a doctor. They have their own set of notions, etc. But I think it's time to break all the notions. Doctor, many a times people with urticaria also complains of getting very, very tired or fatigued. So is it just because they are itching a lot, or they are, they are into so much of stress, or some other reasons could also be responsible for this?
and there's no direct relation with the fatigue or anything. But yes, if a person of urticaria is getting weakness or malaise or sometimes even feeling weak or feverish, then we will try to look beyond the just urticaria. We
Mm.
should investigate that kind of cases. There could be some nutritional deficiency associated, like anemia. So anemia is very common in India, and itself can cause urticaria. So that is one thing which is really missed sometimes. So we tend to investigate that kind of person. Even there could be some other kind of inflammation in the body or in your joints or vascular tissue, which is called vasculitis. So we try to look beyond the common scenario of just urticaria, and we should investigate that kind of cases.
Right. Now, when a person comes to you with urticarial rashes, what are the tests, etc., that you normally advise them?
Exactly. Yeah. So as I told, in acute urticaria, which is less than 6 weeks, I generally do not investigate. When it
Right.
is chronic more than 6 weeks, we test for common things like CBC, which gives us idea about how your hemoglobin is there, or is there any infection in the blood. So CBC and ESR is the common test that gives us idea. Apart from that, a lot of people are tend to have subclinical thyroid condition these days. So urticaria sometimes helps us in diagnosing thyroid conditions. Even borderline sugar or diabetes can be picked up like this. And sometimes people are having internal inflammation like vascular conditions or collagen conditions. So for that we do a specific test which is called ANA test, which helps us in picking up this kind of rare diseases. We also screen urine sample to look for any signs of infection or any other thing. So these are the common investigations. If we get a particular type of clue in this, we tend to investigate further. This is how the
Okay.
protocol is.
Right. Fair enough. And doctor, is there any dietary precautions or do's and don'ts for patients of urticaria?
Yeah, so generally what the thing is, people are putting a blanket advice in each and every patient of urticaria that these things should be avoided, but I don't believe that because that can cause sometimes nutritional deficiency, unnecessary implicating so much of restrictions. So yes, again in chronic urticaria or acute urticaria patients, if we get a history that this particular food item is causing urticaria, if the patient itself or herself is saying that this is the thing, then we definitely tell them to avoid that kind of food items for certain time. Apart from that, we advise them generally to avoid all the preservative or colored food items because these food additives are the commonest cause of allergy these days because of the this era of eating fast food and all. Apart from that, we ask them to avoid certain kind of foods like seafood, which is a very common reason for allergy. Apart from that, lot of people are allergic to dairy products, so we ask them to avoid dairy as well. Even foods like tomato, onion, garlic, they can also cause allergies. These are the common things we ask them to avoid. Apart from that, there is a concept of virud ahar in Ayurveda. We take the positive thing from that, and we tend to advise patients to avoid mixing of different kind of foods. Like suppose you are taking milk, then avoid taking onion, garlic, or any salty food, or any sour fruit like a mango or something with milk. Even avoid taking milk with seafood or non-veg food. These things can trigger inflammation and allergic response in your blood and cause urticaria.
Right. Shania Sen is here. A similar question, and her question is: should I avoid certain foods or substances? I have some kind of allergy from brinjal as well. Many
Exactly.
times
So,
people are allergic. Yeah.
yeah, exactly. So in this case, she is particularly, she herself is pointing that she might be having some kind of reaction. In this kind of scenario, we ask the patient again to observe how frequently it is causing, and every time if that particular food is taken, are you getting the symptoms? If multiple times this is the scenario, then we definitely advise dietary restriction for few months, and then we again try to introduce that food again in the lifestyle. So it is possible that after giving a break of few months, you might start accepting that food. So
Right.
practically, this is the right way. Yes, but overall, I am against giving the blanket advice of restricting 15-20
Right.
food items.
Just because others are allergic or these are the most, allergic food, you just should not stop yourself from having it unless and until you are having some problem. Now, the thing is, doctor, talking about these food allergies only because people are so aware these days. There's so much of information, floating. Now, what happened? Because you have these tests and all, people will not go and consult with their doctor. They'll directly go to the lab, get their food allergy test done, and they are not that cheap also. They are quite expensive, so they are spending a lot of money as well. And they come to the doctor with the reports that see, I've got my allergy test done and I'm allergic to 50 food items. Now, in practical approach, you can't omit 50 food items from your thali. So, what's your advice? Is it okay to go for these food allergy tests all by ourselves, or we need to go by what the doctor is saying?
Again, a very nice and common question. This is what we problem we are facing every day because of the rampant marketing. People are getting caught in the web, and they are getting lot of investigations done these days unnecessarily. So again, my advice would be not to go for food allergy test just like that. And in fact, we have seen that these kind of tests are actually not that specific. Even though they are highlighting certain food items, I have seen cases where people are easily taking that food and they are not getting allergy. And sometimes there is some food item which they feel that they are allergic, but that is not highlighted in the test. So these tests are not that specific. They are, yes, definitely sometimes helpful when we are not able to figure out the reason, or we are not able to find out a clue. Then we sometimes recommend this kind of test as a supportive measure, not as a proper diagnostic tool.
Right, exactly. And doctor, is urticaria contagious?
Not at all. That is a very common myth. It is not at all contagious.
Okay. Now, many a times people again with chronic urticaria because they are on long, long medication. Their basic question is, do these medications have long-term complications or something?
Yeah, again, this is again a very common question people tend to ask us. Yeah, so every drug has its own plus and minus thing. So as a dermatologist, our role is that to find out the best medicine for you, which is very safe and which can be used for longer period because this condition requires long course of treatment. So we tend to balance that thing. And yeah, but the commonly used antihistamines, which I told, cetirizine, levocetirizine, loratadine, which are very safe. People with urticaria or even people with other, allergic like conditions like asthma, they tend to take it for several years. So these kind of drugs are very safe. At the same time, if we go for some higher drugs like say steroids, or there is a drug called cyclosporine, which sometimes we have to use. So those drugs are very specific and they cannot be taken without supervision of a doctor, and they should not be misused or should not be taken by yourself. So this depends on which kind of drug you are taking, but general most of the drugs are very safe, and they can be taken for longer period of time.
Hmm. And I think by not doing self medication, you can actually, curb down the chances of long term complication, because doctor know what they are prescribing you, and they know how much dosage, the duration, etc. So go by them. We have John Vergis with us. His question is, how can I prevent future episodes or manage recurrent urticaria?
So again, see, this is a very tough question to answer. See, there is nothing like preventive thing here. Again, depends upon your day-to-day observation. If you feel like particular kind of things are causing allergy, say example, you are allergic to sunlight or cold temperature, or maybe sweating is triggering allergy, then you try to balance your lifestyle in such a way that you are protecting yourself from this kind of triggers. Example, some food is causing allergy, then you try to avoid that kind of food items. Otherwise, there is no prevention in urticaria. And long-term management, again, it is like as per your doctor's prescription. If you are being advised particular set of medicines, then the best thing would be to follow that prescription as per the doctor's advice, and don't stop the medicine unless and until advised.
Just because you mentioned don't stop the medicine unless and until you have been told by your doctor. The thing is that, especially again in chronic urticaria cases, the patient, because they are on long medication, maybe for 3 months initially, you have asked them to follow the prescription. Now in 1.5 month, if they see that they are not having any symptoms or signs, they'll stop it, because now they have got the routine. They won't even inform their doctor. They'll stop the medication all by themselves. Now, again, after a few months, when they'll see those signs, then again, because they have the prescription, they'll go get the medicines and start taking those medicines again, without even keeping the doctor in loop. Now, my question is, doctor, I'm sure you also get patients who do such practices, who will stop on their own and start again on their own with the prescription again. What's the hazardous thing about this practice?
See, not really hazardous, but yes, definitely it. See, we have to educate the patient that this is the drugs which we are giving to manage chronic urticaria. The intention is not to just give you symptomatic relief from itching. It is directed towards controlling your whole condition overall for longer period of time. So if you are doing a course for say 3 to 4 months, it increases the probability that you don't get a relapse attack or recurrent urticaria. At the same time, if you keep on breaking the treatment into small parts and just do SOS kind of treatment, then we may not be able to achieve the results which we are hoping for. Then it just becomes a symptomatic treatment as and when required. You just pop the medicine. So it is an endless thing then. So it's in your best interest that you complete the treatment, and then there is a good hope that you might not get the urticaria again.
Okay. And doctor, maybe a person is not immediately able to go and consult a doctor, but he or she is getting urticarial rashes, and that is itching a lot. So a lot of discomfort is there. Is there anything we can do for immediate relief, or anything that we can apply on those lesions?
Yeah, so a very common lactocalamine or calamine is easily there in almost every household.
Mm-hmm.
So if you are having a limited lesions on few parts of the body, you can apply calamine. It gives a soothing effect, and it tends to sometimes subside localized urticaria. Apart from that, sometimes people get it due to hot temperature or sometimes sweating. In that kind of specific scenarios, taking just a common bath itself is alleviating the symptoms. But yeah, again, this is very specific. We cannot generalize it. Sometimes people even get urticaria because of water. It is called aquagenic urticaria. So that can
Yes.
be counter effective in this kind of scenario.
Yeah,
But
the
yes,
whole Yeah, the whole
calamine.
problem is that one can get urticaria from anything and everything. So yeah, anything under the sun and under the sun can
Yeah.
be the triggering factor. So yeah, so the foremost thing is that we need to go and consult a doctor. Now, doctor, before we wind up the whole session, any take-home message for our viewers?
Yeah, so overall, we have been repeating the same thing again and again. The most important thing as a viewers, you should understand the complexity of this urticaria as a condition. generally people take it very lightly or ignore it, and they say that if simple one medicine is able to control it, why are you giving three medicines? But you have to understand beyond the simple thing which is visible. Urticaria is very complex. Even today people are not able to properly find a complete cure for it. So you have to compare it with severe conditions like diabetes or hypertension, where people have to take medicines again and again. At least we are hoping that we don't have to take medicines for that long duration, but take it a bit more seriously, and always try to complete the course as advised by the doctor, and don't ignore it, and if required, investigate it, because urticaria can be a simple sign of something hidden inside the body. So we should always take it very seriously.
Absolutely. Thank you so very much, Dr. Hardik, for your valuable time. It has been a very informative session for our viewers, and I'm sure they'll use this information to prevent themselves and their near and dear ones from getting urticaria. And in case they get, at least now they know that where to go. So don't self-medicate, don't do home remedies, don't experiment. Go to a qualified dermatologist. Thank you once again.
So much.
And viewers, thank you for your active participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We're also available on YouTube, Twitter, and Instagram. Thank you. Goodbye.